Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to our CDC-approved diabetes prevention program. Today's module is called More About T2. During this session, we're going to help you learn more about preventing or delaying type 2 diabetes, and you do that by losing weight and being more active. In this session, we're going to actually talk about the basics of type 2 diabetes, how to find out if you actually have type 2 diabetes, and if you do have type 2 diabetes or know somebody that has it, how to manage type 2 diabetes. There's some facts about type 2 diabetes that you need to know. Number one, most people with type 2 diabetes check their own blood sugar daily or weekly, and they track the results of that blood sugar. So most of them all have or should have a blood glucose monitor. Number two, many people with type 2 diabetes take medicine to control their blood sugar. Now, you can control type 2 diabetes with just diet and exercise, but by and large, most people need to have one or two medications on board to get their blood sugars to their goals, and also to get their hemoglobin A1C to a target of less than 8%. 7.5% is where we like most of our patients to be. And then people with type 2 diabetes may get lab tests. So when they go to their doctor, they usually get their blood drawn so that they can measure their hemoglobin A1C, but also they do urine testing to make sure that they're not spilling protein into the sugar, into the urine. So you have to do urine testing and blood testing if you have type 2 diabetes. So when you learn this session, again, we're going to maybe have you have to change your action plan, and that's part of the process. So let's talk about the basics of type 2 diabetes. In people with type 2 diabetes, what's going on is that the body does not make or use insulin. Insulin is a hormone that comes from the pancreas. So the sugar that we eat ends up building up in the blood, and it doesn't get into the cell because the insulin is the key that opens up the cells to allow the sugar to get out of the blood into the cells. So if that doesn't happen, then the cells don't get enough energy, and over time, that high blood sugar can cause many, many health problems. So we have found that people that have type 2 diabetes with high blood sugars can have problems with their heart and their blood vessels. It can be the leading cause of strokes and heart attacks. You have problems with your nerves, your eyes, your kidneys, your feet, your gums. We have people that have more dental caries if their blood sugars are high, and you can have problems with your skin as well. So these are all of the things that happen when your blood sugar is too high. Now, you're more likely to get type 2 diabetes if you are overweight or obese, so if you're too heavy, if you spend a lot of time sitting down or lying down, if you have a family history of diabetes, so you have a parent or a sibling that has had type 2 diabetes. If you're in certain ethnic groups like African Americans, Latinos, Native Americans, or Asian Americans. If you're 45 years or older, this is because just as you get older, that causes your blood sugar to go up. So we're also now seeing type 2 diabetes in younger patients as well. And if you've had a pregnancy where during that pregnancy you got diabetes, it's called gestational diabetes. Those folks tend to have an increased risk of getting type 2 diabetes later on in life. Let's talk about Mike and Henry's story. So Mike is at risk of type 2 diabetes, and he's trying to prevent it by living a healthy lifestyle. Mike's dad, Henry, he actually already has type 2 diabetes, and his goal is to try to keep his blood sugar in a healthy range. So what does that mean? That means when he gets up in the morning, we want that fasting blood sugar to be somewhere between 90 to 130 milligrams per deciliter, and he should be testing his blood sugar at least 4 to 5 times a week with a blood glucose monitor that he uses at home. Now, Mike and Henry have very similar eating and fitness goals. And they are both trying to reach and stay at a very healthy weight. But they have to do that by tracking what they're eating and tracking their activity. Now, unlike Mike, Henry checks his own blood sugar every day. And he actually records the results. Most of your blood glucose monitors now have memory, where that blood sugar reading that you get is stored right inside the machine. Now, Henry also takes pills to control his blood sugar. Mike and Henry both keep an eye on their health, but Henry has to go to see his healthcare provider on a regular basis. And when he goes there, as I said, he has to take some blood test and urine test. In addition, they check his blood pressure, his cholesterol, his kidney function, and once a year he needs to get his eyes checked, and they should check his feet on a regular basis. Now, Mike has lost weight, and his latest blood sugar numbers are normal. His provider says he is on track to prevent or delay type 2 diabetes. Henry's latest blood sugars are also normal, and his provider told him he's doing a great job at keeping his blood sugar in a healthy range, which again is in the morning fasting, blood sugars between 90 and 130, and the hemoglobin A1C, which should be done at least 2 to 3 times a year. That test should be between 7 to 7.5%, depending upon your risk factors and your age. So I want you to pull out a pencil and paper and our charts here, and you're going to answer some of these questions for me. Number one, how would you change your life if you happen to have developed type 2 diabetes? So how would your life change if you had type 2 diabetes? I want you to jot down what that would actually mean to you. And then number two, I want you to jot down what will you do to prevent type 2 diabetes. Now, we've had several sessions. You've learned a lot here with us. So you should be able to have some good ideas on what you will do personally to prevent getting type 2 diabetes. I want to thank you again for your attention today. We hope you enjoyed learning more about type 2 diabetes. For more information, the other modules are available. They're on our website, hovhealth.com. If you need help changing your lifestyle or you have any questions, feel free to call Healing Our Village at 800-788-0941. We look forward to talking to you.